Hello everyone, I am Dr. Ronak Jain, working in STANLEY Hospital Chennai as an internal medicine resident. We all know that the world is going through this coronavirus pandemic, and many of my friends and well-wishers keep calling me up and asking me about what is this coronavirus and how do we prevent it. With all this media hype, I know many of you will be afraid, and through this video, I hope I can help you get some clarity on this COVID-19 as we call it. So in this video, I'll be discussing with you on how to prevent coronavirus, and if you get it, what are the symptoms of coronavirus and when should you seek medical attention. So there's a proverb where it says prevention is always better than cure, and that holds very true, especially for coronavirus. So the first and the foremost and the most important way of keeping yourself safe from coronavirus is washing your hands. Your hands are the medium where the virus goes into your body through your eyes, nose, and your mouth. So, washing hands regularly is very important, especially before you plan to bring your or touch your face with your hands. I can see many of my patients just washing hands like this. That's it. That's not the correct way of washing hands, and you are still likely to get infected. So the most important thing to wash your hands is the correct method, which I'm going to tell you now. So take adequate soap, okay, and apply it evenly on your hands up till the wrist, okay, and then start by interlacing your fingers like this, okay, and then one hand like this through the web spaces of your hands, then the other hand, okay, and then the back of the fingers get missed, and that's a very important area not to be missed. So like this, now you can clean the back of your fingers, and now the other hand, and then don't forget the thumbs, very important part, like this, okay, then your palms now, and then the top area, and then rinse with water, okay. This will take you about around 40 to 45 seconds average, and do all these steps to prevent yourself from getting coronavirus, and not just washing your hands abruptly for namesake. That is not ideal, okay, and it will still doesn't make you be safe from coronavirus. So hand washing is a very important part. So now the second most important way of preventing yourself is wearing a mask. I'll recommend a triple layer surgical mask rather than a cloth mask whenever it's possible. So wear a mask always when you go outside. Don't go to crowded places. Always maintain 1 meter distance between the person whom you're talking to, and always make sure the other person also wears a mask while he talks, so the chances of getting yourself infected comes down considerably. And it's not needed to wear a mask when you're at home with no one around you, or when there is no one with symptoms of coronavirus at your home. If at all there's a suspected case or a family member with coronavirus who's suspected of having coronavirus, you might have to wear a mask at all times whenever you are talking with them or going into their rooms, and make sure they are wearing a mask too while talking to you. Okay, so it's not needed to wear a mask always. The other ways to prevent coronavirus is to avoid touching your face with your hands, especially the eyes, the nose, and the mouth area. Please avoid touching them. And then eat healthy. Keep yourself well hydrated. Exercise for at least half an hour for 5 days in a week. And sleep well. Sleep at least for 7 hours a day. This will also improve your immunity. So now coming to the symptoms of coronavirus, sadly, there's no specific symptom that if you have the symptom, you have coronavirus. It is very vague. I mean, the symptoms of coronavirus can be very similar to a very common flu, a common cold. So you cannot say that if you have a cough or a fever that you have coronavirus. So Please, first of all, foremost thing, don't be afraid, don't be stressed out if you have a fever, cough, or cold, or body pain. Talk to your doctor, ask his or her opinion, and let him decide for you. Please don't come to conclusions that you're having coronavirus and get stressed out. Many of my patients call me up and say that they are having cough, sore throat, so and so, and they think they have coronavirus, and they think that's the end of the world for them. It's not always so. Leave that decision up to your doctor whether to get you for a COVID test or not. So the normal, like the most commonly, the symptoms are you'll have a fever, then you'll have a cough, you'll have a cold. Cough is particularly dry cough. You'll have loose motions. You can have a loss of smell and taste. But you can have all this. It's not needed that you should have everything. You can have either of them. And the most important symptom is like breathing difficulty. If you are having any trouble breathing, visit your doctor immediately. Okay, and it's very necessary to rule out COVID-19. So breathing difficulty warrants to rule out COVID-19. And again, don't be afraid, be calm, go to your doctor and let him decide for you. Please don't jump to conclusions, please don't stress yourself out. Actually, my hospital where I'm working, I see many patients who are asymptomatic, but they're stressed. They're stressed from here, and that's creating problems. And that's shooting up their BP, and that's creating a sense of fear, which can again cause a lot of problems. So please be calm, let your doctor decide that for you, and seek medical attention immediately when you have any shortness of breath, or if the fever is above 1 or 2 degrees, or if you are having any drowsiness, or if you're not able to talk properly, or even while talking you're finding it difficult to breathe, then these are some of the warning signs where you have to seek immediate medical attention. So now you have taken the test and you have found that you have turned out to be positive. First of all, be calm, don't stress out, don't freak out, don't think it's the end of the world. Go to the doctor, get yourself examined. If the doctor advises admission, admit yourself. Or if he advises home isolation, that is, if you're perfectly all right at that point of time, he will advise you to take care of yourself at your home itself. And this is the most important part where I'll be talking to you about what you should do when you're isolated at your home. This will apply to confirmed cases of COVID-19 and also those who are suspecting of having COVID-19. So always have a thermometer at your home. Check your temperature every 8 hourly, that is thrice a day. And if anytime the temperature is above 1 or 2, visit your doctor or the nearest hospital. And one more thing, this is called the pulse oximeter. Okay, this is a very handy instrument which estimates the amount of oxygen in your body and how well the lungs are able to absorb the oxygen. So how to use the instrument is open it up, keep it on your index finger of either hand. Okay, turn it on. The readings the instrument will start estimating the reading. Keep this for 15 seconds after the reading comes. Okay, after the reading comes, keep it for 15 seconds and see what's the reading. Note it down, and then repeat the same with the other hand index finger. Okay, so now you have done it. Now what you should look for? It calculates two readings, that is, one is the heart rate and one is your oxygen saturation. Beneath each reading there will be written whether it's a heart rate or oxygen saturation. So you can see here the bigger font is the saturation, the smaller font is the heart rate. It's written below pulse rate and the saturation. So always look at your saturation, that is very important for you. It should be 94 or above. At any time if it is below 94, you should go to the hospital and get yourselves examined. Okay, so this is a very important way of observing yourself at home. Do it every 8 hourly, or anytime you feel breathless, anytime you feel that there's a difficulty breathing, check yourselves and see whether the reading is above 94. Okay, don't get it confused with the heart rate. See whether you are checking for the saturation. If it's below 94, go to the doctor and get yourselves examined. Other thing is that prone position. What do I mean by prone position? Prone position is like sleeping on your stomach. Okay, so sleeping on your stomach helps you to get more oxygen absorbed in your body while your lungs are still recovering from the disease. Okay, so try to sleep in prone position, or that is on your stomach, for most of the time, unless you have any other condition that prevents you from sleeping on your stomach. So I've told you what all you have to do when you're isolated at home. You can also do yoga and meditate. Even that will help a lot. And now coming to some of the common questions my patients ask me is that how long should I be isolated at home? So generally it depends upon the state you're living in and your doctor, but generally it's 14 days that you have to remain isolated. Then the next question is what all can I eat? You can eat all healthy foods. Okay, don't eat anything which can irritate your air passages or irritate your throat, or don't drink anything cold which can again irritate your air passages. And can eat everything healthy. Okay, so can I take bath? Yes, obviously you can take bath. And there is nothing that you shouldn't take bath when you're having a fever. You can take bath, dry yourself nicely out, wear good clean clothes, warm clothes, and hygiene is very important. Body hygiene as well as your hand hygiene, very important. So can I turn on the AC? Turning on the AC, some people might have dryness in the throat, which may lead them to cough. And also some people don't like to turn on the AC when they have a fever or they're not feeling well. It's better to avoid. And do I have to take a retest? Generally, that also depends upon in the state which you're living in and the doctor. But here in Tamil Nadu, we generally don't take a retest. We based upon the symptoms, we discharge them after 14 days. So retest is generally not needed. So this was a short attempt from my side to educate you and to make you feel that the media hype is nothing and it's just stressing you all out. Please remain calm, have mental peace, that's more important, and follow all the precautions to prevent you from getting the disease. And once, if at all, if you get the disease and if it's severe, let the doctors handle it for you. Trust your doctors. They are putting their lives, we all are putting our lives for you to make you all feel better. So trust us and always follow whatever we say and stay healthy. Okay, stay indoors, stay healthy, take care, maintain all precautions, and I hope we all together will tide over this situation, and hopefully very well in the near future we will be able to see, or we would see, a flattening of the cases and then a downward fall of the cases, and hopefully we can win over the disease. We have to. So we need all the support from the public to support us in this crisis, so that we all can come out emerging victorious. So that's it, guys. If you have any doubts, you can mail me. I'll leave my mail after this video, so that you can contact me if you have anything, and I'll always be happy to help. Take care. Thank you.